Coronavirus is hitting the Navajo Nation hard. With roughly 175,000 residents, this Indigenous reservation has a higher COVID-19 infection rate than any state in the U.S.
Been coughing out blood for about a week from the virus. It was something. I've never got a cold like that.
Despite the high rates of infection, the crisis here has received little mainstream media attention. We've come to find out why the virus spread so fast.
It becomes deeply personal and overwhelming with every death that we hear about.
And witness the toll that COVID-19 is taking on this Native community.
These families are desperate. They want to ensure that they don't inadvertently spread this virus.
Widespread mining has contaminated the water and environment.
They would just drink the water from there. They never knew that it was terrible. They've all died from cancers.
That and limited access to fresh food makes people on the reservation especially vulnerable to the virus.
It just feels like the pandemic has exacerbated existing problems in our communities.
Janine Yazzie was born on the reservation, which extends into the states of Utah, Arizona, and New Mexico. Since the pandemic hit, she's been delivering food throughout the community.
These families are desperate and they're trying. They want to ensure that they don't inadvertently spread this virus in their communities, but what other choice do they have when they're in a household with 6 grandchildren that are hungry and that want water? They have no other choice but to try to go out to these border towns to get whatever they can afford.
Today, she's outside the reservation handing out masks in Gallup, New Mexico.
We're here at Walmart to give out masks to our relatives that are only wearing a bandana, our elders that have no mask at all. We know a lot of our elders are going to be out because it's the first of the month and they've gotten their Social Security checks.
One of the reasons COVID-19 is spreading so quickly is that most people shop in the same places. There are just 13 full-service grocery stores in the entire Navajo reservation, which is roughly the size of West Virginia.
In the beginning, when families were diagnosed with COVID, they were just told by the hospitals to go home for 2 weeks and self-isolate. And these families live, 70 to 120 miles away from the hospital. So they would immediately go into panic mode and start to go shopping in the community before going home. But they didn't have masks. They didn't have the ability to sterilize everything.
Residents say food prices are high on the reservation, and that's why most people come to border towns to do their shopping.
There's been a lot of criticism, especially of mothers and people bringing their children to stores like this. But a lot of people don't realize that we have no child care. When people are traveling 80 to 120 miles to get here, you leave your children at home for the whole day. And that's not an option for some of these families.
But for many, this long day trip to the store may have been worthless. On the same day, Gallup's mayor called for a full lockdown.
It seems like the shutdown was to keep us out and keep them safe. But at the end of the day, that is Indigenous territory. That is Dene land, that is Zuni land, that is Pueblo land. If anybody's our visitors, then it's the people who are trying to shut us out. They need to remember that they're on Indigenous land.
In the last few weeks, the COVID-19 infection rate on the reservation has surpassed the numbers of the most affected states, New York and New Jersey. It now has more than 2,825 cases per 100,000 people. Emerson Nez survived the illness.
The first week of April, I was just laying in bed for a good 6-7 days. I barely move and just isolate myself. The second week got even worse and ended up going to the hospital about 5 times. Been coughing out blood for about a week from the virus. It was something. I've never got a cold like that. I had a really bad back pain in my lungs. They had to give me some morphine just to take that pain away so I could breathe.
It took Emerson over a month to recover from his symptoms.
We don't know who's carrying it until it's too late, that you already have it and you're sick. Next thing you know, you're in an ambulance on your way to the hospital.
Shendine Herrera is a recent college graduate. She decided to come back home to the reservation to work for her community.
We're going to meet up at the Twin Rocks Cafe, where the Blood Mutual Aid Group has packaged deliveries that will be going out today and the rest of the week.
She volunteers with the Navajo and Hopi Families COVID-19 Relief Fund. The group has raised over $4 million in donations to help families in need.
I'm trying to do what I can during this pandemic and ensuring that our families have food on the table every day, have fresh water to drink, that their babies have diapers.
85% of the roads in Navajo land are dirt roads. Delivering food through this vast territory is particularly difficult.
A lot of families live super far and, my vehicle can't go on a really bad dirt road, so they'll meet us at the main highway and we ask that they stay in their vehicle and we put the box in the back of their truck or in their trunk. We try to be as safe as possible.
Today, Shandine is delivering to her own aunt and uncle on the reservation.
So I haven't seen you guys for a while because of everything going on, so I just wanted to catch up and kind of see how you guys are doing with everything.
The food's all gone, the toilet paper's all gone, all the sanitation supplies are gone. That's what the Navajo people are dealing with today.
Much like 30% of the reservation, the Morgans don't have running water at home. That makes it even more difficult to follow safety protocols and prevent the virus from spreading within close-knit families.
We go to Cortez to get our drinking water, even though we have a well here that we use to water our lawn and our livestock and so forth, but we don't drink it. As I grew up, I used to drink all the water in the springs. As I'm herding sheep, I would just dig a little hole and let it clear up and drink the water, and there was no problem. But over the years, and with all the oil and gas activity, the water has all gotten bad.
Up until the mid-80s, 30 million tons of uranium ore were extracted from Navajo land. The dust from more than 500 abandoned mines are still contaminating streams and wells. And up to this day, coal mining and power plants, as well as fracking, continue to contaminate the water.
My uncles used to go from mine to mine, and their kids would play in all of this mining dust, the yellow dust, and the water. They would just drink the water from there, and they never knew that it was terrible. Well, they're all gone. They've all, died from different cancers.
But it's not only contamination that's having an adverse impact on health. Limited access to fresh food is also a chronic issue.
The Navajo Nation is a food desert by every definition. We don't have fresh produce in our diets. It's expensive. I think it's important, for people to see that aspect when they look at the statistics on why Native people have, high rates of diabetes, high rates of other health issues that are linked to nutrition.
The Navajo have managed to survive for centuries in this land, and for the most part, they've made it on their own. David Saucier is a professor and Navajo medicine man. He believes that going back to a more traditional relationship with the land will help his community get through the pandemic.
What we have always talked about is to try to revert back to the use of our land, to plant corn, squash, melon, and other vegetable and fruits that we can use rather than buying from Bashas', Safeway, and all these other grocery stores.
And to get the process started, he and a group of elders are blessing seeds to distribute among the Navajo.
The purpose to say a prayer and to bless the seeds, and then also to ask that there will be an abundance of rain.
And with the seeds also goes a prayer that this community may continue to exist and thrive long after the pandemic.
We have stories about pandemic among our people. There's one, they refer to that as the Spanish flu. And our people, they refer to that as the Kosansa. There were other viruses, but we've always been able to survive that. The bottom line is that we have relatives out there that are really close to you and that you want to continue to be with them long after this pandemic passes. We want to continue as a group, continue on into the future.